Greetings and welcome once again to another exciting episode on the Professor Kareem Ainsley Encounter. It is yours truly, Kareem Ainsley, and I'll be taking you through the series of exploratory terrain concerning medical technology. Yes, we'll understand who the medical technologist is and who the laboratory medicine practitioners are. In exploring these dynamics, we will come to an appreciation of the importance of this overlooked profession. Yes, there is a profession that is serving as the backbone of all laboratory results, if not all, most laboratory results, and aid in diagnosis. And indeed, this profession is often overlooked or even obscured from sight of the average individual. But without them, the hospitals would not be able to function efficiently and effectively. Patients would not be able to get their results. Doctors would not be able to make the orders in order to aid in diagnosis. So they are a pivotal section of the whole healthcare dynamics. And these persons are generally referred to as medical technologists, clinical laboratory scientists, or medical laboratory scientists, and in some jurisdiction, even biomedical scientists. The area of focus and emphasis in this course of study include hematology, clinical chemistry. It also includes blood bank or immunohematology, microbiology. It also includes cytology, histology, immunology, serology, toxicology, virology, bacteriology, and all the different areas in which laboratory results and data are necessary in order to aid in diagnostic operations. And to be honest, the work that is instituted by these set of individuals don't only limit to the lab. They have to be there for pre-analytic phase of the testing in order to guide as to what samples should be collected, what volume of samples should be collected, how the samples should be collected, and the necessary measures to be taken prior to the collection of those samples. And then before it even comes to the lab or in the laboratory environment where testing is done, guess what has to happen? It has to be prepared. Well, the lab has to be prepared to receive those samples. Hence, we have to engage in pre-quality control measures, documentation. We have to do calibration, quality controls, and then if everything is okay, then and only then can the laboratory testing be engaged. And after the laboratory testings are engaged, if the requirements were fulfilled and the results generated are okay, they are passed on to the verification process. However, if there are discrepancies or the results are skewed or they are not as expected and intended based on the pre-requirements, the clinicians have to understand what the results are saying. And you have to remember that these individuals are only seeing the results, the numbers on paper, but they have to use additional information from the different sections of the lab to aid in coming to a conclusive diagnosis in order to send out results which can be used in life-saving treatment of patients. And yes, patients benefit when everything is done efficiently and in accordance to how it was designed. Because if something went wrong in the pre-phase, then it affects the analytic phase, and the results will be generated would be in error. And those erroneous results can be a life and death situation. And we don't want to make any form of mistakes, because when these people make mistakes, a lot of time people lives are compromised. and we cannot afford that to happen. So, after it has been analyzed, then we moved into the pre-analytic phase where the investigations are done and verifications occur. Then these results generated to guide in diagnosis are transmitted to the physician and then eventually into the patient's portal for their viewing. So, the laboratory scientists, the laboratory medicine practitioners, they are very important to the healthcare industry, and they facilitate most of the testing procedures that you would probably go to get a stool sample taken that is sent to the lab, blood sample drawn that there is sent to the lab, urine sample that also is sent to the lab, or any other body fluid that you may have that there is also sent to the lab. And for those females who are watching, yes, even when you move into doing your pap smear, those samples are sent to the cytology laboratory, usually so they can do their assessment by different methodologies to determine if there is any growth which could be significant to cause any form of progression into the undesirable cancer. When the biopsies are done, those are sent also to the lab, and those are usually done in histology. So the gamut of areas that the medical laboratory scientists practice in are vast and diverse. You may be wondering, how is it that many persons don't know or have an idea as to all that is taking place in the background? That is exactly why, because it's taking place in the background. So the next time a nurse may say, why do we have to recollect the sample? You will understand why. Maybe it was just how it was collected. Maybe it was the state in which it was received in the lab. There are myriads of reasons which would impact the results that are generated, which should be saving the patient's life. But guess what? If the results conflict with that which is expected, it means then that something must have gone wrong. And that is the investigative nature of the clinicians, to figure that out as they practice. If those are things that you're interested in, or even if you want to get insight about this profession and understand some of the nuances and some of the verbiage that are used in the laboratory, then please join us as we get into the meat of the matter of the meat, which you came here to devour. It is indeed the expectancy that you will join us on the inside as we head into the lab to enjoy all that is possible from the perspective of a clinical laboratory practitioner. Enjoy and see you on the inside. Signing out is your Professor Kareem Ainsley.